All right, so this is a 4-year-old. He came in through the ED last night with nephrotic syndrome. He's here with mom and dad. I'm gonna call him Jacob. Hi, Jacob. My name is Emily. I'm gonna be your nurse today. How you feeling, buddy? Aww. So I would ask his parents what was going on and wash my hands. Just kind of get the lowdown from them. They said that he had swollen arms and legs and some ascites. So his abdomen's swollen. So I would now take his vitals and see what's going on. All right, buddy, this is just gonna go on your finger. Just a little squeeze, okay? And then this is gonna go around your arm. And I'm gonna stick it over here because you got the IV in this arm, okay, buddy? So this is just gonna be a tight little squeeze, okay? And I'm gonna listen to your arm. Alright, so it looks like his blood pressure is 130/87. Listen to your heart, okay, buddy? So I'd listen to his apical pulse for a minute. Alright, so his heart rate is 84. His O2 is 95 on room air. I would then get a temperature on him. I don't have a thermometer. Get a temperature on him. 98.7. Alright. And his respirations are 19. So then I would go ahead and I'd measure him, get his weight, his height. So it looks like he's 40 pounds, 43 inches long. And then I go ahead and do a head to toe assessment on him. All right, buddy, I'm just gonna look you over, okay? So I'd have a pen light and look in his eyes. So it looks like he has some paraorbital edema. I'd have him sit up so I can see if he has any JVD. Can I feel your pulses? Thank you. Can you squeeze my hands for me as tight as you can? And can you pull them towards you and push them away? Thank you. So I'm just gonna have you lay back, okay? Oh. And I'm gonna listen to your lungs. So you take a deep breath every time I stick my stethoscope on you, okay? I'll have you sit up and I'll listen to your back. All right, and then I'm gonna listen to your belly, okay? All right, and since his abdomen's distended, I wouldn't push too hard, but I'd just see if, does that anything hurt? All right, so when I go down to his feet, I'd look for a fetal pulse. I'd check for edema. Can you push my feet away, or my hands away? Can you pull them towards you? All right, good job. So it looks like he has some edema in his legs and his arms. Fetal pulse was there, radial pulse is there. So I will go ahead and go talk to the doctor and see what he wants me to do. I will get back with you. Here is your call light, and I'll turn the TV on for you, okay? All right, so as of right now, I would want to make sure that there's a scale in the room, just to monitor daily weights, since he have a little retention edema. So we'd want to monitor those daily weights just to double check that he is losing that fluid rather than just keeping it. And I'd also want maybe a urine hat or a graduated cylinder to measure the strict INO that he is, that we're keeping track of, maybe a chart to write on it hourly, just so that he can see, because he's a little kid, just that we are monitoring it, and it'll more like hands-on than as an adult they really wouldn't care. But so I would double check with that, and then the mom asked about a meal since he hadn't eaten. So as of right now, he would be on a low sodium, low fat diet, less than 2 grams per day, and he'd also want to limit the protein, 40 milligrams a day. And we're also going to limit fluids to 1 to 2 liters a day. So he does have an IV right now, but we would limit the oral intake just so that he's not collecting more water for that water retention and that edema. And then that protein would also be based on his height and weight. So with his 40 pounds, 43 inches, they'd base it off of how much protein he's getting through that. So I will go check with the doctor and see what he wants to do. Here's your cola. If you need anything, just let me know. Thank you. All right, Jacob, I'm back. So I'd wash my hands. So the doctor did order some labetalol, which is a beta blocker. It's IV push, so it's 0.5 milligrams per kilogram every 6 hours as needed to help decrease that blood pressure since it is a little hypertensive. So I have that here with me. Put some gloves on, and you're not going to feel anything. It's just going to go straight into the IV, so you're not getting any pokes. So I would check his wristband, name, date of birth, allergies. I'd check the 5 rights, person, drug, dose, route, and time. So I would take this port right here, and I'd wipe it off. Then I'd unscrew the syringe part. I'd screw this on it, and I'd push it over the allotted time that it needed. And then I'd unscrew it. I'd take another one and wipe it back off. All right, so there is that. So then I'd come back and check I'd stick these in a sharps container and throw these in the trash. I would come back and double check on to make sure that he's not having any adverse reactions to that labetalol. And after 6 hours, if he still needs it, I'd get another 0.5 milligrams per kilogram. So the meds I'd expect to be ordered right now would be some diuretics to help reduce that swelling, the ascites, the edema in his legs and forearms, and then that periorbital edema, just to kind of help him be a little more comfortable. I'd also expect an antihypertensive, which is what that labetalol is, an ACE inhibitor or a beta blocker. And then I would also anticipate some corticosteroids to help restore that kidney function back to normal, so it's not causing all the issues that it is as of right now. It would help to maybe reduce the symptoms of the nephrotic syndrome and get back to regular. So then I would also do some teaching. I would explain to the parents that it's important for to monitor that I&O and that daily weights just to make sure that he is discarding that excess fluid and to reduce the water in his system so that he doesn't go into fluid overload or get an infection with buildup of fluid in his lungs or maybe pneumonia. And we would treat that prophylactically. I would also monitor vital signs and O2 stats, especially blood pressure, every 4 hours, and then also every 6 hours to see if he needs that labetalol again. And then I would also do a UA request a UA to monitor excess sodium levels, the protein in his urine, and maybe some labs to see if anything has changed. I would want to also watch for infection just to double check that he's not getting there with that excess fluid. But other than that, I would come back every 6 hours or every 4 hours, do vital signs check on him, and then administer that labetalol every 6 hours as needed. Other than that, I would wash my hands, and then I'd pass the report to the next nurse. So I'll be back. I'm gonna go get another nurse for you, who's relieving me from my shift, and we we'll see how things are going, okay? Here's your call light. Alright, Jacob, this is Ashley. She's going to be your nurse taking over for me. So Jacob's a 4-year-old who was brought in through the ED with a flare-up of his nephrotic syndrome. He came in with some paraorbital edema, edema in his legs and forearms. The doctor did order 0.5 milligram per kilogram of labetalol to help with that hypertension because he has a little bit of a high blood pressure. Those legs, they seem to be doing a little bit better, but I did want to let you know that he might be prescribed a diuretic to help flush the rest of that out. He's been good for me, alert and oriented. Everything seems normal other than that edema, some ascites in his abdomen, and just to watch for infection, monitor his INO, strict INO, so we're making sure that he's getting rid of that fluid. So, all right, Jacob, well, I hope you start feeling better, okay, buddy? I'll see you tomorrow if you're still here, okay? You guys have a good day. Thank you.